Hello and welcome. If you're a parent who's been looking for answers about your child's health, you are absolutely in the right place. In this explainer, we're going to break down a group of complex conditions that can show up really early in life. We'll get into what they are, the signs to look for, and most importantly, how you can find some clear answers. So let's just start with a question that gets right to the heart of it all. For so many families, unexplained health issues can feel like you're trying to solve this impossible puzzle. But what if a key piece of that puzzle was hidden in the very process that powers your child's body, their metabolism? It's helpful to think of these conditions as a kind of hidden health puzzle. Now, while any single one of these disorders is pretty rare, when you look at them as a group, they can have a huge impact if they go undiagnosed, affecting everything from a child's growth to their brain development. Okay, so let's dive in. The term metabolic disorder can sound really intimidating, right? But the core idea behind it is actually pretty straightforward once you break it down, and that's exactly what we're going to do. So what are we actually talking about here? Well, these are inherited conditions where the body is missing a specific enzyme. You can think of enzymes as these tiny, essential workers that are crucial for chemical reactions. When the right worker is missing, one of two things usually happens. Either harmful stuff builds up to toxic levels, or the body just can't make the vital things it needs to grow and thrive. Now, this analogy is just a fantastic way to picture it. Imagine your child's body is a busy factory. Metabolism is the assembly line, running 24/7. In a metabolic disorder, one of those key workers, an enzyme, is missing. This can cause the whole assembly line to get jammed up with leftover materials, or it could stop the factory from making a really important final product. It's a simple idea, but it really makes it click. And we're not talking about just one condition. As you can see, there's a whole range of them. You've probably heard of PKU, right? That's where the body can't break down a part of protein. Others, like maple syrup urine disease, have some pretty distinct signs. This really just shows how many different ways that factory assembly line can get disrupted. So, what does this actually mean for a child in their day-to-day life? Well, the effects can be really far-reaching. Because metabolism is fundamental to everything the body does, a hiccup in the system can impact brain development, muscle control, even just feeding and growth. And in some serious cases, it can affect a child's behavior and awareness. And this brings us to a really, really important part for any parent watching. How do you know if you should be concerned? A lot of these conditions have signs that are pretty subtle, but there are definitely specific clues you can keep an eye out for. Okay, so if you notice any of these things, it's for sure worth having a conversation with a specialist. We're talking about developmental delays that just don't have an obvious explanation, or maybe a child losing skills they once had. That's a big one. Also seizures, poor growth, even with good nutrition, or even something really specific like an unusual odor in their urine. And of course, if there's a family history of metabolic disease, that's always an important clue. Now, if you are seeing some of those signs, the next question is obvious. What happens now? The good news is there's a clear, methodical path to getting answers. This isn't some confusing maze. It's a step-by-step process that doctors follow. And this lays that process out perfectly. It all starts with a detailed history to look for patterns. Then comes a thorough physical and neurological exam. The real heart of the investigation, though, is often simple blood and urine tests that screen for metabolic markers. From there, genetic testing might be needed to lock in a diagnosis, which leads to the final and honestly the most important step, creating a management plan that's tailored specifically for your child.
So, why is there so much emphasis on getting these answers as early as possible? Well, it's because a timely diagnosis can be absolutely life-changing, not just for your child, but for your entire family. This quote really just says it all, doesn't it? Early clarity is everything. It means you can finally stop searching in the dark and start giving your child the specific support they need right now, when it matters most. Let's just look at this comparison for a second, because it makes the stakes crystal clear. With an early diagnosis, you've got a path to better outcomes, often with manageable things like special diets or supplements. Without it, a child faces that constant uncertainty and the risk of really serious long-term effects. It's the difference between having a clear plan versus just ongoing worry. All right, let's quickly run through a few common questions. Are these conditions treatable? Yes, many of them are manageable. Is the standard newborn screening enough? It's a great start, but it doesn't catch everything. And will the testing be invasive or difficult? For the most part, no. It usually starts with simple blood and urine samples. These are the kinds of quick, clear answers that families really need. So we'll end with this thought.
If any of this has resonated with you, if it sounds familiar, remember that the journey to answers begins with a single step, just asking the right questions. Pursuing that clarity could be one of the most important things you ever do for your child's health and for their future.